Why we often realize our illness too late. In today's fast-paced world, health is often an afterthought until something goes seriously wrong. Many people push through fatigue, dismiss minor aches, or ignore persistent discomfort, assuming these are just normal parts of life. However, these subtle signs often precede serious illnesses. The delay in recognizing sickness can have dire consequences, turning what might have been a manageable condition into something life-threatening. Understanding why we often realize our illnesses too late requires an examination of psychological, social, and medical factors that contribute to this widespread issue. One of the main reasons people fail to notice their illnesses early is the human tendency to normalize discomfort. Many symptoms of disease start subtly, such as fatigue, occasional headaches, or mild digestive issues. These can be easy to dismiss, especially in a world where exhaustion and stress are often glorified. A culture of perseverance encourages people to push through pain rather than address it. As a result, individuals adapt to a slow decline in health, failing to recognize when something is seriously wrong. The way the human brain processes symptoms also plays a significant role. The body often sends signals when something is wrong, but the brain filters these based on priority. For example, a person dealing with work stress may attribute their constant headaches to mental exhaustion rather than an underlying health issue. This cognitive bias, known as attribution error, leads people to associate symptoms with temporary or external causes instead of recognizing them as potential warning signs of illness. Societal expectations further complicate the issue. In many cultures, showing vulnerability is discouraged, particularly among certain groups like men or high-achieving professionals. Seeking medical help is sometimes perceived as a sign of weakness, leading people to delay doctor visits until symptoms become unbearable. The stigma around certain diseases, such as mental health disorders, also contributes to delayed diagnosis and treatment. Many individuals suffering from depression or anxiety, for example, may rationalize their symptoms as normal sadness or stress, rather than seeking professional help. Medical factors also play a role in late disease detection. Many illnesses, including cancer, diabetes, and autoimmune disorders, progress silently in the early stages. Without routine screenings or specific tests, these diseases can develop unnoticed for years. For example, high blood pressure, often called the silent killer, rarely presents noticeable symptoms until it causes significant damage, such as a heart attack or stroke. Similarly, diseases like type 2 diabetes can go undetected for years until complications arise. Healthcare accessibility is another crucial factor. In many countries, medical care is expensive, and routine checkups are not always affordable. Even in places with chronic stress and busy lifestyles further contribute to the problem. Many people live in a constant state of stress, balancing work, family, and personal responsibilities. When life is overwhelming, health often takes a back seat. A person struggling to meet deadlines or care for children may not prioritize their well-being, dismissing symptoms as stress-related or unimportant. Over time, these ignored warning signs can lead to more severe health complications. Cultural and generational attitudes toward health also influence when and how people recognize illness. Older generations, for example, may have grown up in environments where medical care was less accessible or where illnesses were only addressed when they became severe. This mindset can persist, leading some individuals to believe that seeking medical attention for minor symptoms is unnecessary. In contrast, younger generations with more access to health information may be more proactive, but they can also fall into the trap of self-diagnosis or dismissing symptoms as temporary issues. The delayed recognition of illness is especially concerning for diseases that rely on early detection for effective treatment. Conditions such as cancer, heart disease, and neurodegenerative disorders benefit greatly from early intervention. Unfortunately, by the time many people seek medical attention, these diseases have often progressed to advanced stages, making treatment more difficult and less effective. Late diagnoses not only impact individual patients, but also place a significant burden on healthcare systems, as treating advanced diseases is often more complex and expensive than preventing them in the first place. Lack of awareness and education about certain diseases further exacerbates the problem. Many people do not know the early warning signs of serious conditions, making it difficult for them to recognize when something is wrong. For example, ovarian cancer is often called the silent killer because its early symptoms, such as bloating, changes in appetite, and mild abdominal discomfort, are commonly mistaken for digestive issues. By the time a woman realizes something is seriously wrong, the disease has often reached an advanced stage. Increased public awareness campaigns and better education about common diseases could help people identify symptoms earlier and seek medical attention sooner. The role of genetics in health is another overlooked factor. Many individuals do not consider their family medical history when assessing their own health risks. If a person has a family history of conditions like diabetes, heart disease, or cancer, they may be at higher risk and require earlier screenings. However, without awareness of genetic predispositions, people may fail to take preventive measures or recognize symptoms in their early stages. Lifestyle choices also play a major role in both disease development and recognition. Poor diet, lack of exercise, smoking, and excessive alcohol consumption